I'm Cam Cardinelli with Sale. Just going to give you a brief overview of the work that we do, and then Janna can specifically hop into health insurance programs and what that looks like for securing health insurance for yourself, your employees, and anyone you may know who needs insurance, because our programs are awesome and can pretty much help anyone. So Sale is an agency. We cover 17 counties throughout New York State, helping people live more independently. We have 13 different programs that are direct to consumer services. And then we also do a lot of community advocacy. If you've ever been to CVB meetings, I'm sure you've heard me talk all about it, and kind of the work we do to make Lake George and all 17 counties we serve more accessible for people with disabilities. So if that's something that interests you, at the end, I'm happy to share my contact information for that. But other than that, I'll let Janna kind of hop into health insurance options, and what that looks like.
Hello. So again, my name is Janna Kopacki. I'm Director of Benefit Services here at SAIL. So I oversee 3 different health insurance programs that we have here. One being the Health Benefits Exchange Program, the Age Blind Disabled Program, and then our Community Health Advocacy Program. So I will explain all 3 of those, and I'll start with the Health Benefits Exchange Program. In that program, we assist individuals with applying for insurance through the marketplace. With that, the marketplace looks at a few different things for eligibility. They look at your residency, so you have to have a physical New York State address. They look at your household composition and then your household income. So it is an application. We ask the individual a series of questions. We input that into the New York State of Health database, and then they determine what the individual is eligible for. And that could be it could be Medicaid, it could be an essential plan, or it could be a qualified health plan. And it again would depend on your household income and the household composition. There also, if you're applying for a child, there's Child Health Plus. If you end up qualifying for a qualified health plan, there are tax credits you can apply for, which we can help with. And then we also will be able to help compare plans. There's bronze plans, silver plans, gold plans, platinum plans. We would be able to help explain the differences between those, and help determine what plan would be best for the individual. Do you go to the doctors a lot? Do you rarely go to the doctor? What plans do your providers currently accept? Things like that. Any questions with any of that? If you're a business and you aren't able to provide employees with health insurance, certainly give us a call. We can go to you. You can send employees to us. We can do applications over the phone, and we can pretty much be available at a moment's notice. We have 6 navigators here, which is really helpful. I will move on to our Age Blind Disabled program. That program, we assist people with applying for Medicaid through the county. So there's marketplace Medicaid, and then there's county-based Medicaid, which are 2 very different programs. If you are over the age of 65 or disabled or blind, you don't have to be all 3, just one of them, you could apply for county-based Medicaid. We also assist with working persons with disability. So if there is an individual who has a disability but also wants to work, but doesn't want to lose any other benefits they may be receiving, they can apply for working persons with disability and receive Medicaid through the county, and we can help with that. That application process, that application itself is a little intimidating. If you sit down and look at it, you could be like, all right, this is way too much, which is where we would come in. Our facilitating enrollers know that application like the back of their hand, and they would be able to explain it, and then also explain the notice of decision that comes from the county, which is also very confusing. Um, but again, that's where we would come in and assist. And then we have our community health advocacy program. So that program, I like to split into like two different categories. That program can help with someone apply for Medicare specifically, or can help with any post-enrollment issue they may have. So if they're already enrolled into a plan, whether that's a plan through the marketplace, a plan through the county, an employer-based plan, if you just want help understanding, okay, now you have insurance, now what does that mean? How can I use it to the best of its ability? We can assist with that. If there is a billing issue, if you think you were billed and you shouldn't have been, if it just wasn't coded correctly, we can assist with all that. Pretty much any question that may arise once you already have insurance, our community health advocate will be able to assist with that. If you need help calling the insurance company, if you need help obtaining like a prior authorization, if you're looking for reimbursement from the plan, we can assist with all that. Any questions? That's kind of a lot, and I don't want to, I could get into the nitty gritty of all of it, but that can sometimes go in one ear and out the other because it's a lot.
I haven't gotten anything in the chat yet, so I guess
Awesome.
you can
And
keep rolling.
yeah, and like Janna mentioned, we're happy to come on site to enroll employees. That is something we can set up pretty quickly.
Yes. The one nice thing about kind of what came out of the pandemic is we can do all of these applications over the phone now. They used to have to be done in person. And COVID changed that for us. So now we can do all appointments over the phone. If that's easier, or like Cam said, we can go to you can come to us. We try to make it as accessible as possible.
So I think you've covered all of insurance. Any questions? I know that was quick. Usually, there's quite a few questions that come out of these, so we like to leave plenty of time for those.
I guess while we have the space and the time to do it, we have quite a few people on here who I'm noticing are in hospitality, lodging, accommodations, things like that. I know, I've learned a lot about sale and the offerings that you guys have in addition to the employee insurance. I'm just wondering if you wouldn't mind sharing some of those services and what you can do for partners, especially like I'm thinking even like short-term rentals, just things like that. Would you mind sort of adding to this conversation with your services?
Absolutely. So our biggest thing, we have kind of two large aspects that we look at when we look at tourism and hospitality businesses. One is our work in the community to make spaces more accessible. So I can come on site to any of your businesses, any of your locations, and do a full walkthrough from, can someone with a disability literally enter the door. That is a barrier that unfortunately we see a lot of individuals face, especially in the area that we all operate in. It's a lot of it's old, historic, that kind of thing. So we can come on site and we can give you a full report of, here's what needs to be fixed. Here's solutions that are obtainable here. We do have access to, giving you some information about funding sources and opportunities there as well. So that's kind of one side of our work that we do a lot with our hospitality and tourism partners. On the other side of that is our free medical equipment loan program. And a lot of folks think of this as that's where I got my, knee scooter for surgery. But we've really grown that program into so much more, and really diving into the adaptive recreational space. People with disabilities are traveling, they're out in the communities. Let's make communities where they can fully enjoy everything that it has to offer. And especially here in the Adirondacks, we want to make sure we fulfill that goal. So our equipment loan program, also known as trade technology related assistance for individuals with disabilities, like I said, we've really grown into this space of adaptive equipment. So, for example, we just got a hiking backpack so that someone with a disability can go into this backpack with a wheel on the bottom, and all the weight is bared on that wheel, so you can go hiking. We have golf clubs for someone who's in a wheelchair. We have translation devices. That's a huge thing that we're pushing more and more into Lake George is oftentimes, we see language barriers with guests. So we have these little translation devices. They look almost like a cell phone, and it translates back and forth. The chamber office has one, for example. We have a beach wheelchair, so individuals who are, normally in a wheelchair can experience the water and still experience Lake George. We had someone about a year and a half ago now, for the first time experience Lake George and water as a whole. They had never gone swimming, and they're around 40 years old. So really being able to give individuals that opportunity is something we're really big on. We can also provide commodes and basic rollators and wheelchairs and things like that. If you have a guest coming to stay with you and you know about that guest accommodation request and you don't have the equipment to fulfill that, you shoot me an email. I coordinate with our equipment team and we drop it off, a couple days before the guest checks in, and we will pick it up a couple days after the guest checks out. So shower chairs, commodes, wheelchairs, walkers, rollators, Hoyer lifts, anything in that realm, we're happy to help with.
Thank you.
Yeah.
Does
And
anyone else have
Right,
any? Yeah,
quickly,
go ahead.
that program's completely free. There's no charge, there's no rental fees. For hospitality partners, we loan it out to you as a business. So you just kind of have to make sure the guest doesn't walk off with it. But it's loaned out to you. It's a very simple process. Again, you send me an email and we will drop it off. Free, no charge, no questions asked.
So we do have a question coming in. Do you have suggestions on the translator device? We'd likely purchase one for regular usage. We have employees who do not speak English fluently, and we find it to be a barrier.
Absolutely. So we have them in our equipment loan program, and I'm happy to loan one out to you for a couple of months to try it. And then if it works for you, that's really the big thing about this program is you're able to
Test it out.
right, test it out, play with it, make sure it works before going out and purchasing it. So I'm happy to follow up with you after this and make arrangements to get that to you.
And I will send out all contact information as a follow-up as well. She said, yeah, that'd be great. They come in March. So I'll have you, I'll make sure that I send out any contact information in the note.